Today I'm going to talk about two different types of hip impingement, what to do about it, and exercises to improve it. Hi, I'm Alex Zeffer, founder of Resilient Training and Rehab. I've helped thousands of coaches from around the world get more consistent and reliable results with their clients. Let's get into it. The first type of hip impingement is going to happen when somebody goes into a hip flex position and internally rotate the hip. So think about when you're doing a squat, for example, you get to that mid-range or you're sitting down for a long period of time and you want to get up. If you're missing that internal rotation, a lot of times people will complain about pinching or this impingement in the front of the hip. So one of the reasons why this happens is because the hip is going to be tilted forward and the sacrum and the sit bone are going to come towards each other. So again, if I have internal rotation of the hip, then these two structures move away from each other. But if you have a lot of tension in the back part of the pelvis, which is then going to cause a lot of tension or the muscles in the back of the posterior hip capsule, so basically the space between the femur and the sit bone, that gets tight and externally rotates the femur. When somebody goes into this 90-degree range of hip flexion, that is then going to, this space has to open, but if it doesn't, then I'm just going to dump the pelvis forward in order to create that. And so what we have to do with people like this is try to alleviate some of the tension in the back of the hip. So how we can test this is if you get somebody to lay on their back, you bring their knee up to 90 degrees, and then you create this internal rotation. So what you'll see is see how the leg kind of goes out towards the side. So when you do that, that's when they start to feel the impingement. That's how you know that that's what you're looking at. You're looking at an inability of the posterior capsule to reduce tension, open up, so that when you go into those deeper ranges of hip flexion where you require internal rotation, you can do it through the hip versus doing it through the lower back where the whole pelvis dumps forward. Let's go over two different exercises. One's going to be on the ground, the other one's going to be loaded in order to improve that hip pinch, improve the hip impingement. So what you're going to do is you're lying on your back and you're going to grab something that maybe a couple inches tall, and you're going to lay down and put your feet on top of it. And what that's going to do, I've talked about this in previous videos, that's going to naturally bring the pelvis back and reduce tension in the back of the hip. If I have my legs bent in line with my hips, that's going to promote more internal rotation of the hip. And then if I take this block or a ball and I'm going to put it between my thighs, it's not going to be between my knees, but between my mid to upper thighs, then when I push, that's going to open up the bottom part of the pelvis and promote that internal rotation of the femurs. So I'm going to lay on my back. I'm going to have my hands reaching down towards my knees. I'm going to think about putting pressure on the inside arch without lifting up my butt. I always want to keep the tag of my pants in contact with the ground. And I'm going to have my arms here. As I breathe in, I'm going to reach my arms. I don't want you to come up. I don't want you to pull so much that your head's cranking back. Just nice slide as I breathe in, keep my upper back against the ground. As I breathe out, I'm going to press the inside arches of my feet into the pad and squeeze the block. Now, when I breathe in, I'm not going to just let go and relax everything. I'm going to keep that tension and try to go every time, doing about 2 sets of about 5 breaths. So I'm going to inhale as I reach, exhale as I press my feet down on the inside edge and squeeze the block. Now, if we talk about a variation that's more loaded, that resembles a little bit more strength training, I really like the Jefferson split squat. So if I've got my right leg forward, I have my right hand supinated, so turned out, that's going to turn my body towards that side. I'm also going to have my outside arm pronated, so facing back and down towards the ground. So one hand, if I were right leg forward, right hand is going to be facing, or is going to be more open. Left hand is going to be closed, facing backwards. That's going to create a rotation towards this right side. So now what has to happen is my femur actually has to internally rotate in order to stay straight ahead, because my pelvis is turning towards the right, and so everything wants to turn out towards the side. So I've got to internally rotate the hip just to be able to stay straight ahead. That is going to further open up that posterior capsule. And so if I want to get even more, I could even turn the bar or the dumbbells so it's a little bit more on an oblique angle. So it's not front to back straight across, but it's a little bit more of a rotation going on a diagonal. That's going to further emphasize that rotation and create that hip internal rotation, open up the posterior capsule of the hip, and get that foot pronation and tibia to internally rotate. So the second type of hip impingement usually happens on the outside parts. The first one was a little bit more on the front. This one's going to be on the outside. And this is usually when people take a step or they're turning away from that leg or doing something like a lateral lunge or kind of like a hockey stride where they're going out towards the side. So anything that requires this abduction, which is just the leg going out towards the side, they start to get the pinch. And typically in my experience, when that happens, a lot of people have a pelvis that is going forward and turned away from that side. So just think that in this case, I've got hips that are turned towards the right, but I've also got a pelvis that is tilted forward. So this anterior pelvic tilt on top of that. This creates this little bit of a twist through the TFL. So muscles like the TFL that attach from the top part of this pelvis, this pointy part, down towards the top part of the femur. And when it gets tight or when it gets overly worked, it starts to pull those structures together and you get that impingement. So anytime you're trying to extend the hip, where you're doing it through your lower back instead of actually doing it through the pelvis, that's a lot of times when you start to experience that impingement there. So again, the first one has to do with hip flexion, internal rotation. This has to do with hip abduction and extension of the hip. So these people are usually missing the ability to extend the hip. So movements like straight leg raise are going to be limited, and anything where you're lying on your side and doing this side lying hip extension, which I've mentioned in the previous video, those movements are going to be limited. And to really gauge to understand if that person is impinging there, you can get them to lay on their side, do some degree of hip abduction. So in order to improve this, we're going to now have to open the back part of the pelvis, just like we did with the first one. But the difference is we're going to have to focus on bringing the pelvis back at the same time. So remember, the first one was the pelvis is dumping forward. This one is going to be the pelvis is dumping forward and turning away from that side. So now what we have to do is we're going to have to get hip extension on the right side to turn us back towards the left, then do exercises that are putting hip extension and force into the ground to teach the body how not to arch the lower back to do it, but to be able to move through the pelvis so that you're not getting the pinch on the outside of the hip. Okay, so let's say that we have hip impingement on our left side. As I said, one of the first things we want to do is we want to drive hip extension through the right side to turn our pelvis back to the left. Because in this scenario, we have a pelvis that's tilting forward and towards the right, so I get this hip impingement on the left side. So the first thing we're going to do is something that I like to call a lateral strider, and what that is going to do is going to drive hip extension on the right side to turn the pelvis to the left so that pelvis doesn't want to go forward and towards the right. So what you're going to do is you're going to lay onto your left side, and from your right shoulder down to your right hip should be straight across. I don't want you to be rolling forward. I want you to be nice and stacked. You take your right leg and you're going to slide it up the wall slightly. So it's not going to be in line with my hip down here. It's going to be slightly up, and it's going to be straight but not locked out. So if I have this slight bend in my knee, that's going to allow me to get into my hip. If I extend my knee, my pelvis is going to roll forward. I'm going to do it through my back. So I'm going to have this leg bent at 90 degrees. I'm going to support my head. I'm going to take a big breath in through my nose. As I breathe out, I'm going to push the inside edge of this right foot into the wall. Now, when I push into the wall, I should feel my butt working, and I should feel the pressure going down into the ground. So it should feel like by me pressing into the wall, my left hip is getting smushed into the ground. That is going to create that rotation. I don't want to create the rotation by turning everything. I want to do that by pushing into the wall. So when I'm pushing into the wall, if you don't feel the glute, you could play around with the foot positioning, You can slide your foot a little bit more forward. You can slide your foot a little bit more back, a little bit higher up. You can just play around to see where you feel that, because when you feel that glute kick on, that's how you know you're in the right position. So you do about 2 sets, about 5 breaths. So you're going to inhale. As you exhale, you're going to push your foot into the wall. You're going to hold that position. Take a big breath in. Feel your upper back stretching, maybe your side stretching. And then as you breathe out, push into the wall. And again, keep that knee slightly bent at all times. The second exercise is going to be the ipsilateral, toes elevated, staggered stance hinge. I know that sounds like a mouthful, but it describes exactly every single aspect of it. What I'm going to do for this exercise, I'm going to hold the dumbbell in the same side arm as the leg that's working. That's what ipsilateral comes from. I'm going to elevate my toes. What that's going to do is that's going to open up the back part of my pelvis. So think about separating the space between my sit bone and my sacrum. It's going to drive a lot more hip internal rotation and hip extension. Having the dumbbell on the same side is also going to drive a little bit more of that hip extension because I'm putting more load onto that leg. So when I stand up, it's going to cause me to push myself forward and drive more hip extension. By getting to the staggered stance position with having the left side back, again, I'm putting more weight on that left side. I'm going to turn my pelvis towards the left. And one thing that I really like to do with this is with the right arm is reach towards the left foot as I'm going down, because that's going to keep me turned towards this left side. Remember, with people who have this type of hip impingement, as they go into hip extension, they really want to arch their back and they want to turn their pelvis to the opposite side. I want to keep that hip extension happening in the hip without the pelvis trying to turn towards the right and without them doing it in their back. By holding the dumbbell in the ipsilateral hold, that is going to keep me into this left side, and it's going to keep the pressure within my left glute and to drive that hip extension while also preventing myself from turning over towards the right. So this ipsilateral hinge is a great way in order to reinforce the hip extension and to make sure it's happening from the hip versus a compensation where I'm rotating towards the other side through the lower back. If you like this alternative perspective on trying to improve hip impingement, check out my lower body program. A lot of these exercises you can find within the lower body program, specifically phase 2 of that program. That's going to help just reinforce hip internal rotation, hip extension, while also doing it without compensating. If you want more content like this, make sure to like and subscribe, and I'll see you next time.